Hello. Welcome all viewers to Doctor's Dialogue series. Myself, Dr. Gayatri Pandit Rao. I am homeopathic physician from Pune. सभी दर्शकों का डॉक्टर्स डायलॉग सीरीज में स्वागत है। हर सेशन में मेरा यह प्रयास रहता है कि स्वास्थ्य के आधारित हम नए नए विषय पे चर्चा करें अलग अलग डॉक्टर्स से। तो आज का भी टॉपिक ऐसा ही कुछ खास है। So first, let me introduce our guest speaker today, Dr. Amol Javdekar. Welcome, sir, to the series and session. Dr. Amol is M.B.B.S and M.D. His specialization is into pathology, and he's done it from very prestigious college from Pune, B.J. Medical College. Welcome, sir. And he is not only a pathologist, but he is also a clinical practitioner using integrative medicinal therapy. Now, viewers को ऐसा लगेगा कि how did I came in contact with Dr. Amol. So it's a very different story. Actually, I came across a book. I will request Prabhat to show the book to the viewers. This book called as Introduction and Orientation to Integrated Medicine. I came across this book, and when I started reading it, it was so fascinating to read about everything given in this book by Sir. His profile itself is very fascinating. लेकिन अभी हम पहले सेशन की शुरुआत करेंगे पैथोलॉजी से, बिकॉज सर हिमसेल्फ फर्स्ट इज अ पैथोलॉजिस्ट. ही इज एक्सपर्ट इनटू दैट. Or half session, we will talk about his integrated medical practice. So yes, doctor, welcome once again.
Yes, thank you, Dr. Gayatri.
Yes, and it's a very actually never heard before idea, because I myself was so enthusiastic while reading everything in that combination, of pathology practice as well as integrated medicine. So it's very different. Unusual combination. So your expertise is into pathology. So how do you manage, both sides, like you being a pathologist as well as you treat patients with different pathies, like even homeopathy, Ayurveda. So can you first tell about that?
Yes, Dr. Gayatri. It is very difficult and challenging, but it is highly satisfying also. When I see such remarkable improvements in patients' health, it makes all the efforts worth it. See, pathology by itself is a very vast field. Working both as a clinician and pathologist at the same time is technically very complex, but the unique advantage of working in this fashion is that I get to see both sides of the situation. It rarely happens when you work only as a clinician or as a pathologist. The clinical knowledge of the patient helps me interpret my pathology results, and being aware of the finer nuances of pathology work helps me in deciding how much importance to give to pathology results. The ultimate result is better patient care.
Right. But sir, actually, how this desire ignited in you, like you came across other doctors regarding all these pathies, like how was your journey?
See, you will be surprised, Dr. Gayatri, to know that my journey into homeopathy began even before I enrolled for M.D. pathology. Way back in 1997, 1998, when I was working as a government medical officer, I happened to meet some patients who derived magnificent benefit when they were using homeopathy. So naturally, this kindled desire to know more about this science. I started studying homeopathy on my own, but over the next many years, I was fortunate to get guidance from many homeopaths, and most valuable help was provided by Dr. Ajit Kulkarni, then Dr. K.C. Shah, Dr. Pushkar Godbole. They taught me about this fascinating, highly effective therapeutic science. So basically, I have been studying homeopathy for the past 25 years. As
Oh,
far as as far as Ayurveda is concerned, I have been studying Ayurveda for the past 8 years, and I am indebted to Dr. Poonam for Dr. Jyoti Mundargi and Dr. Prayag Sethia for the guidance which they have given while they were teaching me about this 5,000-year-old science. So, over the years, more practical experience built up, and upon encouragement given by Dr. Ajit Kulkarni, I decided to publish my
yes.
own, which was just shown, Introduction and
Yes.
Orientation to Integrated Medicine. So that is how
Yes,
it
Dr.
calls.
Ajit. Yes, Dr. Ajit is a well-known figure in homeopathy in Pune and even in Maharashtra. Many all over India
He's
people know
actually an
him and his work.
internationally recognized homeopath,
Exactly,
as you know.
exactly. So it's a great opportunity that you got, actually, I should say, to
Yes,
learn
that's
all this
also
from him. That's good.
true.
या सो फर्स्ट डॉक्टर लेट्स हम पहले पैथोलॉजी के बारे में बात करेंगे क्योंकि व्यूअर्स को मालूम है कि आप बेसिकली पैथोलॉजिस्ट है तो थोड़ा पहले का सेशन हम पैथोलॉजी पे बात करेंगे
Okay.
तो सबसे पहली चीज जो आती है मन में इज अबाउट इवन आई बीइंग अ डॉक्टर फर्स्ट थिंग दैट कम्स इनटू माय माइंड इज करंट scenario if you see in medical field annual health checkups is a big name everywhere so actually patients को ऐसा हरदम लगता है कि unnecessary है health checkups तो आपका इस पे क्या what is your views regarding this annual health checkups और rather I would say कि हरदम ऐसा होता है कि you know every now and then doctors write some or the other test to the patients so how you try to analyze these keys, how much really health checkups are required and how much is you can say exaggerated notion about it?
Hey, Dr. Gayatri, to anyone who has this question in his or her mind, I would like to ask some questions which will provide an insight into this issue. Question 1. Haven't you ever heard of comments that Mr. So and so was so hale and hearty and doing all his routine work and suddenly had a heart attack and expired? He was just 40 years, 40 plus, such a young age to die. Question 2. Haven't you ever heard of people commenting that they were suffering from seemingly minor complaints like repeated early morning headache, ignored that, assuming that to be tension headache, and were shocked when the MRI revealed an advanced brain tumor? Question 3. Haven't you ever heard of people commenting that they were quite okay, just experiencing repeated nausea or upper abdominal discomfort on the right side, non-alcoholic, non-smoker, and they were surprised when the pathology lab report stated that they were having deranged liver function test? To be honest, we all have heard many such real life incidences, but we would like to believe that these things happen only to others, not to us, right? We would rather enjoy bliss in ignorance rather than coming face to face with an underlying medical condition, however trivial it may be. So we should not forget that in majority of the diseases, in the early stages of majority of the diseases, either the patient has no symptoms
Dr. Amol,
or minor symptoms. Yes.
I
Any
think there's some
problem?
network issue.
Okay.
Yeah, I think there was some network issue on your end.
So should I repeat anything
No,
from
it's
where?
okay. You can continue. You can continue. Like,
Right. Right.
yes.
So what I want to tell is that we all know that in majority of the diseases in the early stages there are either no symptoms or minor symptoms which patients choose to ignore, rather than follow. That is one of the reasons why annual health checkups to be done. The other reason to do annual health checkup is even when you are not experiencing any symptom, is that you get to know your own baseline result. Okay.
Sir, what is actually baseline result?
See, it is
Explain to
basically,
viewers maybe.
yes. I hope the network is okay now.
Yes, we can hear you. Yes.
Yes. So basically, it is the patient's own value for a given test when there is absolutely no reason for any abnormality of that test. Let me explain this in the
Okay,
form
आप
of
थोड़ा
an example.
थोड़ा हिंदी में बोलिए एक
हाँ जी.
सेंटेंस तो मालूम पड़ेगा व्यूअर्स को.
हाँ, बेसलाइन रिजल्ट यानी वो रिजल्ट अगर किसी पेशेंट को कुछ भी तकलीफ, ओवर्ट तकलीफ नहीं है, और कि वो जो टेस्ट वो करने चाह रहा है उसका एबनॉर्मल वैल्यू आने के लिए कोई वजह नहीं है. ठीक है. तो आई विल एक्सप्लेन दिस टू यू इन इंग्लिश इन द फॉर्म ऑफ एन एग्जाम्पल, राइट? Now let us say that the normal range of normal hemoglobin for adult Indian females is 12 to 16 gram percent.
Right.
Okay. Let us
Right.
say a female's normal hemoglobin is 16 gram percent, but it is not known to her because she never got it tested. Okay. She develops something known as a hemolytic process in which, because of some disease, her RBCs start getting broken down. Because of that, her hemoglobin starts falling, becomes 15, 14, 13 gram percent, and by chance she presents to the pathologist at a time when her hemoglobin is 13 gram percent. In a very busy pathology lab where the pathologist has no access to patient's complaints, there are less chances that the pathologist will think of a hemolytic process at a hemoglobin of 13 gram percent. Okay. But if the baseline 16 gram percent is known to the pathologist and compared with now 13 gram percent, the pathologist will note a significant drop of 3 gram percent of hemoglobin. And then he will view the peripheral smear carefully, do some other tests, and will be able to detect this disease at a very early stage. Understood?
Correct. That means what Dr. Amol is trying to say is पेशेंट्स जब टेस्टिंग के लिए जाते हैं तो उसकी जरूरत क्या रहती है कि पैथोलॉजिस्ट को मालूम नहीं रहता है कि पेशेंट की क्या अदर तकलीफ है, बिकॉज यू नो ही इज इनटू वेरी सो बिजी लैब्स रहते हैं, शेड्यूल्स आर सो टाइट, सो डॉक्टर पैथोलॉजिस्ट डजंट नो द कंडीशन ऑफ द पेशेंट. सो अगर पेशेंट के पास उनका एक बेसलाइन रिजल्ट मालूम हो पेशेंट को कि हरदम मेरा हीमोग्लोबिन इतना इतना रहता है, तो नेक्स्ट टाइम अगर किसी टेस्ट को जाए और रिजल्ट अगर कम ज्यादा दिखा तो करेक्ट अनुमान लगाया जा सकता है कि एग्जैक्टली क्या रीजन है. राइट डॉक्टर अमोल, दिस इज व्हाट यू आर ट्राइंग टू से, इजंट इट?
आई विल जस्ट गिव यू वन मोर एग्जांपल. हिंदी में बताता हूँ कि अगर किडनी के बारे में हम डिस्कस करेंगे. आजकल पेशेंट को पता रहता है कि क्रिएटिनिन जो जांच है वो किडनी के बारे में बताती है. सपोज एडल्ट इंडियन मेल्स की नॉर्मल सीरम क्रिएटिनिन लेट अस से वेरीज फ्रॉम 0.8 टू 1.3 और 1.5 लेट अस से फॉर एग्जांपल, और एक बंदे की नॉर्मल सीरम क्रिएटिनिन जब उसका किडनी बिल्कुल ठीक है इट इज 0.8 मिलीग्राम पर सेंट. ओके. नाउ बिकॉज कुछ तो बीमारी उसको होती है, किडनी की बीमारी होती है, किडनी फेल होने लगती है और उसका जो क्रिएटिनिन है वो अभी 1.1 हो जाता है. जब वो 1.1 होता है तो पैथोलॉजिस्ट को क्या दिखेगा और पेशेंट को क्या लगेगा, ये तो बिल्कुल विद इन नॉर्मल रेंज है ना. तो वो नहीं सस्पेक्ट करेगा कि मेरी किडनी फेल हो रही है. लेकिन जब पैथोलॉजिस्ट को पता लगेगा कि अरे इसके नॉर्मल 0.8 है, 0.8 से 1.1 हुआ है, ये पॉपुलेशन नॉर्मल में है, लेकिन उस पेशेंट के हिसाब से अगर देखा जाए तो वो 0.8 से 1.1 हुआ है. So even before advanced kidney failure occurs, at a relatively early stage we can detect it. That is the importance of baseline value.
Right. But sir, my question personal would be कि एक ही टेस्ट रिजल्ट पे we should stand and think about, okay, this is the only result which is going to give me so particular diagnosis, or we should do repeated test to properly analyze ki okay, I have done this 2-3 times and now really I am having this condition. Means what I mean to say is ki just we should believe on only one result. Is that so?
देखो, always it is a clinico-pathological correlation. ठीक है. You have a 20-year-old absolutely fit young adult male coming to you who is say a vegetarian for example, and if he is having a creatinine of 0.9 or 0.8, there is no reason why you should repeat. Okay. Repeat कब लगता है कि when it is not clinically correlating और borderline जो
Correct.
results है ना, borderline जब होता है तो you should always repeat.
Correct.
और हम बताते भी है पेशेंट को वैसे.
Right. And what you're just now talking about the asymptomatic thing, अभी जब चर्चा चालू है तो मुझे इतना ऐसा लग रहा है कि हम एक विषय पे बात करें जो अभी 2-3 साल में हम सबने we went through it, that is about asymptomatic mass testing of RT-PCR. लेकिन I completely understand viewers को भी ये बहुत उत्सुकता होगी, लेकिन टाइम की वजह से आज तो ये डिस्कशन पॉसिबल नहीं है, क्योंकि ये विषय भी इतना बड़ा है कि उस पे 1 घंटा भी बातचीत कम होगी. तो आई एम
डॉक्टर गायत्री, हम
लाइक
अलग से उसके ऊपर सेशन रखते हैं उसके लिए.
exactly we will do it again with this one topic because that is what we need answer from you and I hope you will come for that session.
Definitely, sure.
Yes. So but sir, one more thing what I would like to ask you is कि लोगों को ऐसा लगता है कि मेरे सब अगर नॉर्मल वैल्यूज आए तो दे फील कि इट्स वेस्ट ऑफ माय टाइम, वेस्ट ऑफ मनी, वेस्ट ऑफ एफर्ट्स. So sometimes people don't take it very seriously. They feel what is there to test. Me being a physician and practicing, मेरा personal my opinion is that कि at least एक बार तो health checkup, I mean the blood test, especially the basic CBC or maybe the basic test should be done once in a year at least, so that you understand how your health condition is. तो आपका इस पे क्या विचार है, like how people should analyze this?
नहीं, मुझे क्या लगता है कि अगर कोई बिल्कुल ही ठीक है, कुछ भी सिम्टम्स उसको नहीं है, सो फॉर अपेरेंटली नॉर्मल पीपल विद एब्सोल्युटली नो सिम्टम्स, मेरी राय रहेगी कि एक बरस में एक बार कम से कम होल बॉडी चेकअप करना चाहिए. if the patient is between 40 to 60 years of age, okay? If the patient is more than 60 years of age, better to do it twice a year. The actual tests which need to be done can be told by the clinician or a pathologist
itself, exactly.
After taking proper clinical history and doing a clinical examination. Then actual test क्या करना है वो हम बता सकते हैं.
Right. But sir, a very important question here comes up that there are so many pathology labs around. If you see, every locality has these pathology labs. And, these labs offer so cheap sometimes packages. You get ads also in newspapers, everywhere you see. Within 1,000 rupees, you get whole body tests done. So, especially I would say the corporate world, the corporate labs which run. So, sir, like such, can there be chance of malpractices happening in such scenarios? So, what is your take on this?
See, one objective criteria of selecting pathology labs is to check whether they are NABL, NABH accredited. One of the two. Okay?
Okay.
What is NABL? National Accreditation Board for Testing and Calibration Laboratories. Okay. And NABH is National Accreditation Board for Hospitals and Healthcare Providers. Okay? So basically these are autonomous technical councils which do periodic inspection of pathology labs, and if they find that the pathology lab meets certain quality standards, then they give a certificate of quality which is for a specified period of time. My personal advice to patients is to give more importance to their own experience of getting tested from such labs rather than such labels. One thing.
Correct.
The most important criteria for selecting a pathology lab is that it should be, the work done in the pathology lab should be supervised by a pathologist. For a layman, it is difficult to be sure whether in a given lab the work indeed is supervised by the pathologist.
True.
But what
because
can
so
be done
many
is, yes, but
because
what can
so
be
many
done
times technicians are there, and we never get to see pathologist's face also in the lab. So it becomes very means as a doctor, this is my concern. So patients को तो मालूम ही नहीं रहता इन सब चीजों के बारे में. So it becomes very important.
They can do multiple visits to the labs or at least they should insist, as and when they go to the lab, they should insist on meeting the pathologist. See, why I am saying this is because it is a fact, Dr. Gayatri, that there are some pathologists who give pre-signed reports to owned technician run labs. So for all practical purposes, and there is no authorization, for all practical purposes, entire work done is by the technicians and the report generated are by the technicians. You just see the pathologist report. You have heard about this?
ये आप हिंदी में थोड़ा बताइए, because I think this is very very important point कि viewers को मालूम पड़ना चाहिए इसके बारे में.
ठीक है, मैं हिंदी में बताने की कोशिश करूंगा. कैसे रहता है कि कभी कभी ना ये एक मैल प्रैक्टिस चल रही है कि कुछ पैथोलॉजिस्ट टेक्नीशियन ओन्ड टेक्नीशियन रन लैब्स जो रहते हैं उनके यहाँ पे सिर्फ नाम मात्र रहते हैं साइन करने के लिए. क्या जरूरी क्या है कि उन्होंने देखना चाहिए कि ये जो सब काम टेक्नीशियंस कर रहे हैं उसके ऊपर सुपरविजन चाहिए. पूरा काम तो ऑब्वियसली पैथोलॉजिस्ट अकेला नहीं कर सकता और वो एक्सपेक्टेड भी नहीं है ना. लेकिन मैंने देखा है कि अगर पैथोलॉजिस्ट का सुपरविजन नहीं रहेगा ना तो इतनी गलतियां होती है एंड यू नो द पेशेंट्स लाइफ कैन बी इन डेंजर. ओके, यू सी हियर आई वांट टू मेंशन वन पॉइंट, हिंदी में भी बताऊंगा कि आई एम नॉट अंडरमाइनिंग द इंपॉर्टेंस ऑफ टेक्नीशियंस इन फंक्शनिंग ऑफ पैथोलॉजी लैब्स. Technicians no doubt play a very important role in lab functioning, no doubt about that. Problem comes when some technicians, they feel that they are at par with the pathologists and hence pathologists are not required for running of labs.
True.
In 22 years of my experience, I have noted that good technicians with good knowledge usually are humble. They know their limitations and they give due respect to the pathologist. Whereas poor quality technicians, they are the ones who feel that, you know, हमें सब आता है, no need for a pathologist. And day in and day out, mark my words, सब जो कोई viewers सुन रहे हैं, day in, हर रोज हर बार ये गलतियां होती रहती है और उनको पता ही नहीं चलता है कि गलतियां हुई है. ठीक है, मैं उसकी डिटेल्स में नहीं जाऊंगा नहीं तो बहुत वक्त लगेगा. ठीक है.
ट्रू. बट सर वन एग्जाम्पल आई कैन गिव यू कि हमारे रोज के प्रैक्टिस में भी हम ऐसी चीजें देखते रहते हैं कि यू नो पेशेंट कम्स फ्रॉम सम अनदर डॉक्टर, उनके पास किसी लैब का रिपोर्ट लेके आते हैं, लेकिन जैसे आप बोल रहे थे कि क्लिनिकल पिक्चर हम जब लेते हैं तभी इट डजंट मैच विद द रिपोर्ट. सो मेनी अ टाइम्स मैंने भी खुद ऐसा बोला है कि आप एक बार रीटेस्ट करो. सो दिस क्रॉस चेकिंग विद लैब्स जो होता है, and I have seen that the results next time जो आते हैं वो उसके clinical picture को बराबर match होता है. So then what is your view regarding this cross checking or second opinion जिसे हम बोलते हैं, and sometimes really we should blame labs for these mistakes that occur कि जो होने नहीं चाहिए, because this is very important for patient.
See, if the patient asks me this question, the first thing I do is to ensure that apples are being compared with apples and not oranges. Okay, this I do by taking a careful look at, I will just read those points. What analyte is the patient talking of? कभी कभी क्या होता है, फ्री T3 फ्री T4 का रिजल्ट टोटल T3 टोटल T4 के रिजल्ट के साथ कंपेयर करते हैं बिकॉज ये पता नहीं रहता कि ये अलग बातें हैं. Then GHB, glycosylated
this
hemoglobin.
This is very common in free T3 and T4. That is very common. Yes. Even I have observed this.
Yes. Then GHB with HbA1c. GHB or glycosylated hemoglobin is HbA1a plus A1b plus A1c. So the numerical value of GHB and the normal range, of course, will be little bit more than HbA1c. आजकल GHB कोई नहीं करता है, सब HbA1c ही करते हैं. लेकिन पुराने जमाने में GHB एस्टिमेशन होता था और जब ये ट्रांजिशन हो रहा था तब कुछ लैब्स GHB करती थी, कुछ लैब्स HbA1c करते थे. एंड देन यू नो लूजली वी यूज द टर्म GHB और ग्लाइकोसिलेटेड हीमोग्लोबिन फॉर HbA1c. लेकिन ये जो माइन्यूट टेक्निकल एस्पेक्ट है ये पता नहीं रहता है. ठीक है. सेकेंड पॉइंट, is there difference in the method used to evaluate the analytes? For example, alkaline phosphatase measured by the using the DEA buffer, comparing that with alkaline phosphatase using the AMP buffer. Value
Okay.
obtained by using DEA buffer is 2.47 times higher than the value obtained by using AMP buffer. ये पता नहीं रहता है, पेशेंट्स को भी नहीं पता रहता है,
Exactly, but
क्लिनिशियंस को भी नहीं पता रहता है, अनफॉर्चुनेटली टेक्नीशियंस को भी ऑब्वियसली नहीं पता रहता है, पैथोलॉजिस्ट को यूजुअली पता रहता है. Then ADL estimation by the Friedewald equation versus direct ADL estimation. ये थोड़ा टेक्निकल है. Then HDL cholesterol can be estimated
LDL.
by the precipitation method, or it can be estimated directly, right? So
Right.
the results will vary,
Okay.
right? One more
Right.
thing, is there difference in the factors related to sample collection? Okay, most common mistakes क्या रहता है? देखो, ये जो FSH, LH, prolactin, ये जो टेस्ट रहती है ना, तो it should be done on the third day of MC.
So the time is important again. हाँ, कभी आप टेस्ट करते हैं वो भी important है.
See, 99% of the times it is done on the third day of MC. लेकिन क्या होता है कभी कभी ना कि the patient may come in the luteal phase. Okay, 25th day, 24th day of MC, for example. और अगर वो जो पैथोलॉजी लैब है वो इतनी अच्छी नहीं है, सपोज सिर्फ टेक्नीशियन है और उसको ये पता ही नहीं है, तो ही मे टेक द सैंपल. और क्या रहता है, अगर आपने रिपोर्ट देखा है FSH, LH, प्रोलैक्टिन का, उसके ऊपर सैंपल महावारी के कौन से दिन लिया है, which day of the MC is not mentioned. So this mistake can occur. Second mistake, HBS AG positivity at the beginning with its negativity later on in the clinical course. हेपेटाइटिस बी.
सॉरी टू इंटरप्ट यू, लेकिन फिर मुझे यहाँ आप जैसे एक्सप्लेन कर रहे हैं तो मुझे ये लगता है कि एज अ फिजिशियन और अ क्लिनिशियन हम लोगों का काम है कि हमने पेशेंट्स को बोलना चाहिए कि एग्जैक्टली व्हेन द टेस्ट इज रिक्वायर्ड टू बी डन, इजंट इट?
वेरी ट्रू.
बिकॉज दैट इज, दे डोंट नो, व्यूअर्स को, पेशेंट्स को तो मालूम ही नहीं रहता है ना कि ये सब जो टेक्निकल चीजें.
Shall I give you a very very common mistake example? That is a Vidal test. Vidal test. Vidal test ideally should be advised in the second week of after onset of fever, isn't it? But because of lack of knowledge, what happens is very commonly it is advised say on the third or fourth day of fever. तो वो नेगेटिव आएगी, है ना?
और कभी कभी पेशेंट खुद ही जाके टेस्ट करके ही आते हैं. आजकल तो ऐसा सिनेरियो है कि हमको बोलना भी नहीं पड़ता है कि टेस्ट करो. दे कम विद द रिपोर्ट्स कि मैंने ये सब टेस्ट किए हैं. So this is also
next thing what I do is I see whether the inferences given by the two labs are different. For example, suppose the report of one lab is stating hypothyroidism in a patient and the report of another lab testing the sample on the next day is stating hyperthyroidism. So obviously one of the two lab is wrong.
Exactly.
Exactly opposite. So which lab is wrong will depend upon the individual case. You have to go into the depths of it. Depends. That depends.
Sir, I have heard something about random variability. So आप एक सेंटेंस में उस पे थोड़ा रिफ्लेक्ट कीजिए कि what is ऐसा भी होता है, रैंडम वेरिएबिलिटी के भी चांसेस रहते हैं.
रैंडम वेरिएबिलिटी का क्या मतलब है कि सपोज आपने, एग्जांपल देता हूँ, हीमोग्राम. अगर आपने EDTA जो सैंपल है वो हिमेटोलॉजी एनालाइजर को प्रेजेंट किया और थोड़ी देर बाद, कुछ सेकंड्स के बाद, कुछ मिनटों के बाद वो ही सैंपल उसी मशीन के ऊपर वापस रन किया, तो एग्जैक्टली सेम रिजल्ट्स नहीं आते हैं. दिस इज नोन एज रैंडम वेरिएबिलिटी.
So that also is important factor. So I think pathology is really a vast subject and very minute details also are required to be, to judge.
There are so many technicalities to it. Na? That is the reason why it is very important that the pathology lab should be run by a pathologist and the pathologist should supervise the work. क्या हो रहा है ना, आजकल नॉन मेडिकोज इतने घुस रहे हैं इस फील्ड के ऊपर पिछले बहुत सालों से. आजकल इज नॉट past few years, it is many years. I think patients should now state कि no, we do not want non-medicos to enter this field. It is a highly technical field. और आपको तो पता है कि पूरा पेशेंट का जो मैनेजमेंट है वो हमारे रिपोर्ट के ऊपर डिपेंडेंट है. अगर रिपोर्ट गलत आ गया तो पूरा मैनेजमेंट ही बदलता है ना पेशेंट का.
करेक्ट. सो आई थिंक व्हाट सर इज टेलिंग, 2 सेंटेंस में हम समराइज करेंगे फिर से कि सर का यही कहना है कि हेल्थ चेकअप्स साल में एक बार एटलीस्ट करना जरूरी है. ब्लड टेस्ट स्पेशली, बेसिक जो टेस्ट रहते हैं, स्पेशली जब आप 40 या 60 के एज ग्रुप में हैं, एंड इफ 60 से ऊपर एज है तो पॉसिबल है तो अगर 2 बार कर सकते हैं. It's just not that we are want to, it's like not promoting these health checkups, but it is about your own health, कि आपकी हेल्थ आपके हाथ में है और उसकी जांच पड़ताल करके आपको अंदर क्या हो रहा है ये भी मालूम होना चाहिए, और सडन सरप्राइजेस फेस नहीं करना पड़ेगा if you do these things at right time. That is what I think sir is trying to tell. And specially पेशेंट्स ने ये भी देखना चाहिए कि वो जिस लैब से टेस्ट करवा रहे हैं तो उसकी ऑथेंटिसिटी भी जांच करनी चाहिए कि पैथोलॉजिस्ट रन लैब है या नहीं है. सो ये छोटी छोटी चीजें इंपॉर्टेंट है, एंड पेशेंट ने अपनी पूरी हिस्ट्री भी थोड़ा बताना चाहिए पैथोलॉजिस्ट को, तो उनको भी आपके हेल्थ के बारे में थोड़ी जानकारी मिलती है, तो उससे भी टेस्ट में हेल्प होती है. सो आई थिंक दैट इज व्हाट वी कैन समराइज हियर. एंड सर, वेरी डिफरेंट क्वेश्चन कि पेशेंट एंड डॉक्टर रिलेशनशिप जो है इस पे आपके क्या विचार है? लाइक नाउअडेज इट्स बीन रियली वो रहा ही नहीं है, बिकॉज इतना स्पेशलाइजेशन आ गया है दैट एवरी डॉक्टर कुछ भी हो गया तो वी रन टू सम डिफरेंट स्पेशलिस्ट. तो फैमिली फिजिशियन का तो कुछ रोल ही अभी रहा नहीं है.
Actually, you have taken a very important point which you have brought up. See, trust and faith in the treating doctor is of paramount importance for the success of treatment. If the patients they keep on doubting the intentions of even good-natured doctors, then they are going to be at a loss. Okay.
Correct.
So an ideal relationship between doctors and patients should be one of total trust, satisfaction, and gratitude from both the sides. So what you say is right. There has been a deterioration of the relationship. So there are certain duties which patients and healthcare sector both have. So we will just see what they are quickly. Okay. What are the duties of the patients? First is, once an appointment is taken, please stick to it. Patients must value the pathology lab or the clinic's time, the healthcare staff's time. Even without the patient being aware of it, patient को न पता होते हुए भी ऐसा हो सकता है कि the healthcare staff is making certain personal sacrifices to be available to give services to the patient. और अगर उन्होंने अपॉइंटमेंट लिया और वक्त पे नहीं आए तो all these sacrifices they go waste. ज्यादातर पेशेंट ऐसा नहीं करते हैं, लेकिन जो कुछ 1-2 पेशेंट ऐसा करते हैं, यानी कम पेशेंट्स करते हैं, उनको मैं पूछना चाहता हूँ कि अपने खुद के प्रोफेशन में अगर आपके क्लाइंट ने आपकी अपॉइंटमेंट ले ली और वो नहीं आया, आपको कैसे लगेगा?
True.
Same is true.
Time is very important. Time is very important. Patients do like that. They tell ki I will come or I will, and they don't. They take appointment and they don't come. So
which is very bad.
Thing is there. Yes.
Second is be sincere about your health and follow the doctor's advice. If the doctor has told you to do 5 things, do all the 5. Okay. Don't skip 1 or 2 and do the remaining which is convenient for you. If you do not follow the doctor's advice religiously and then you don't derive benefit from his treatment, then I tell patient you have no right to complain to the doctor. You follow all the advice and then अगर नहीं फर्क पड़ता है तो बोलो ना. The doctor should accept his limitation there. Third is offer fees for consultation, investigations and treatment. Don't expect free treatment and you make it clear right at the beginning. Fourth, please ensure regular follow-up until you recover completely. Do give a honest feedback to the treating physician, both positive and negative. Okay, so that he may fine-tune the treatment so as to optimize the results. Okay. Now, what are the duties of doctors towards patient? First is give adequate time to properly examine each and every patient. Doctor should not just hurry up. Just because there is a line of patient does not justify that you should quickly, just ये patient को बिल्कुल अच्छा नहीं लगता है, वक्त देना चाहिए. And अगर ऐसा लगता है कि अरे बहुत वक्त ले रहा है patient, which is okay, हो सकता है, तो he may charge more, and then patient should not say इतना क्यों charge किया. That is not correct.
They can even come again with see there is case history अगर long हो, तो these things might happen. Yes.
Yes, कभी कभी ऐसी होम्योपैथी हम जब प्रैक्टिस करते हैं, 1.5 घंटा 2 घंटा वक्त लगता है. एंड और पेशेंट को ये पता नहीं रहता है कि वो जाने के बाद हमारा एनालिसिस चलते रहता है. वी आर वर्किंग ऑन द पेशेंट even after the patient has left our place. So the efforts have not stopped there. They continue. Okay. Second is a gentle and human approach is needed. It is the duty of the doctor to be kind, compassionate and human in dealing with all patients. Okay. Then देखो डॉक्टर को भी खुद के पर्सनल प्रॉब्लम्स हो सकते हैं, फ्रस्ट्रेशंस हो सकते हैं, लेकिन वो पेशेंट के ऊपर नहीं निकालना चाहिए. ओके. थर्ड इज एक्सप्लेन द टेस्ट रिजल्ट्स क्लियरली. Pathologist or the clinician should explain the test results clearly. है ना?
This never happens, sir. This never happens because patients को मालूम ही नहीं रहता है क्या टेस्ट बताई है डॉक्टर ने. They come with the report, क्या टेस्ट की. They say कि I don't know, वो डॉक्टर ने मुझे ये करने को बोला और मैंने ये टेस्ट की. किसके लिए टेस्ट है, क्यों कर रहे हैं, nothing.
Dr. Gayatri, here I would like to tell you, in my experience, I have seen 3 types of patients. The first type is of patients who are, extremely obsessed with their health. They are extremely anxious, very much apprehensive. They want to know everything. They will Google everything. This is one category of patient. True. There is another category of patient, they are very, they are least bothered. उनको एक तो टेस्ट करना ही नहीं है, कुछ डॉक्टर ने बताया तो वो ट्रीटमेंट भी नहीं लेते हैं. ये सेकंड कैटेगरी है. और एक बीच वाली category which is good category where the patient shows optimum concern about his health. It is this category of patient which benefits maximum from healthcare sector.
True. Overly obsession about these tests and all is also
दोनों
not
extremes नहीं चाहिए.
दोनों extremes नहीं चाहिए. That is true. Optimum
बीच वाला पार्ट रहता है.
Exactly.
वो चाहिए.
True. So sir, I think pathology बहुत वास्ट है, सब तो पॉइंट्स कवर नहीं कर पाएंगे. तो वी विल मूव ऑन टू मेजर पार्ट नाउ कि आप इंटीग्रेटिव मेडिसिन में है. तो मैं प्रभात को एक बार फिर से बुक दिखाने को बोलूंगी सभी व्यूअर्स को. द बुक, प्रभात, कैन यू शो द बुक प्लीज? प्रभात, हाँ, यस. See, the book name is Introduction and Orientation to Integrated Medicine. ये किताब है. जब भी मैं पढ़ रही थी तो I came across Dr. Amol, and that is why he is there today on this Doctor's Dialogue session. मैं इसमें से दो सिर्फ फॉरवर्ड पढ़ना चाहूंगी कि ये बुक why is everybody should read it. ऐसा नहीं है कि सिर्फ डॉक्टर्स ने लेना चाहिए. एक आम आदमी भी ये बुक पढ़ सकता है फॉर सेल्फ नॉलेज rather than doing Google and all. Somebody, some clinician has written from his own experience. तो आपने जरूर ये बुक पढ़ना चाहिए. तो मैं सिर्फ फॉरवर्ड पढ़ूंगी. डॉक्टर पूनम फाल इन्होंने लिखा है, अच्छे पॉइंट्स है. Vast majority of doctors remain busy working in their own area of specialization, and they resist deviation from the comfort that this practice provides, that is integrative practice. There is hardly any inclination to learn and comprehend other systems of medicines with an open mind. तो मुझे ये sentence बहुत अच्छा लगा जो लिखा है कि any doctor should have very open mind to learn other system of medicines also. To some people, this may seem unnecessary and irrelevant, but she says that she definitely finds this whole exercise of experimenting and writing on the study of integrative medicine, which is a road very less traveled. तो उनका भी सजेशन है कि सब लोगों ने पढ़ना चाहिए इस किताब को. एंड ऑफ कोर्स डॉक्टर अजीत कुलकर्णी, वेरी फेमस होम्योपैथ, उन्होंने भी लिखा है. कि मैसेज ही हैज गिवन टू एक्चुअली ऑल फिजिशियंस, सब डॉक्टर्स को मैसेज दिया है सर ने कि physicians of all pathies need to be open-minded and oriented, to be unbiased and unprejudiced, to be integrated and enlightened. So actually what he's saying is physicians' ultimate aim is to mitigate the suffering, to preserve and restore the health. तो हर एक फिजिशियन का यही कर्तव्य है कि किसी भी तरह से पेशेंट को अच्छा लगना चाहिए, और उसके लिए हर एक फिजिशियन और क्लिनिशियन को रिक्वेस्ट है कि सब जन ओपन माइंड रखे हर एक पैथी के लिए, हर एक सिस्टम के लिए, क्योंकि लास्ट 2-3 इयर्स में तो हम सभी ने एक बहुत चैलेंजिंग सिचुएशन देखी है. आई थिंक ऑल डॉक्टर्स विल एग्री टू दिस, and we all needed to be united and strong to face such situations in future. So I think this is very important that all physicians should respect each other's fields as well as be open minded towards all this. Yes, thank you Prabhat. तो मैं सर को अभी ये पूछना चाहूंगी कि सर आपने किताब में लिखा है कि मदर मेडिसिन. So actually this is very interesting words I felt. What is mother medicine? Why you have used? So explain about that.
Yes, sure. See, I was thinking of how to make an impressive start to my book when this idea came to me. Okay, it is as though allopathy, Ayurveda, and homeopathy are three children of mother medicine. Okay, so
allopathy is also a child, you are saying, right?
Yes, yes. So I'll just read from my book. Dear reader, I am Mother Medicine and this book is my story. As you can see, I am thousands of years old. Age has only made me wiser. I have three children: Ayurveda, allopathy, and homeopathy. Ayurveda is the oldest, traditional, old fashioned, but mature and effective. Allopathy is my modern, gadget friendly bacha. Smart, intelligent, progressive, quick in giving results, and a firm believer in the power of evidence. Homeopathy is my youngest. थोड़ा हटके है, difficult to understand, very different from the other two, but magical in results if tapped well.
True.
As a mother, I know all my three children have their positives and negatives. It pains me to see them fight with each other all the time. Individually, they have so much to offer to the world. They have so much talent in them that united they will achieve the impossible and help me bring smile to each and every ailing mind. If only they could keep their ego apart, try to understand each other and work hand in hand. Hope my three children read this story and gain wisdom.
Sir, I really would clap for this thought, because this
Yes.
is out of the world thought, and I liked it so much that this
Yes.
Coming from an allopath, a pathologist, it really, I'm really appreciating you for this thought.
Many viewers or many readers, they gave me very positive feedback about this. They like this idea very much.
This thought, an idea itself is very beautiful.
Because she says that hope my three children read this story and gain wisdom, for this is as much their story as it is mine. Happy reading.
Oh, very good, very good. So I think थोड़ी झलक तो viewers को मिली ही होगी कि कितना interesting ये book होगा. तो I will request everybody कि आप ये book जरूर लीजिए and you read it. Sir, you have talked.
International level पे accept हुआ है.
Wow, great.
Yes, US, Malaysia, then I think Dubai, and almost every state of India में doctors ने लिया है, and they have sent me feedbacks also.
Very good, congrats. Yes, the book itself is really very good. So actually, sir, you have compared one more very nicely. You have made a what you say analogy. You have compared three pathies with the judicial system. So ये आप हिंदी में जरूर बताइए viewers को कि ये judiciary से कैसे मिलता है ये three medical systems.
अच्छा, मैं ऐसा ही सोच रहा था जैसे ये मदर मेडिसिन की आइडिया आई मन में वैसे ही ये दूसरी आइडिया है, यानी पेशेंट को थोड़ा बताने, पेशेंट को ऐसे नहीं, व्यूअर को बताने के लिए एक एनालॉजी देके, ठीक है,
हाँ,
एनालॉजी को
इजी
हिंदी में क्या
समझने के लिए, exactly.
हिंदी में क्या बोलते हैं पता नहीं।
कंपेयर करने के लिए कंपेयर करने.
Yes, yes. So, if one were to compare these three pathies with judiciary, this is how they come out. Allopathy is more like modern judiciary, passing judgments and trying to deliver justice while giving importance only to hardcore facts. What can be submitted in the form of evidence. यानी मॉडर्न ये जो अदालत है वैसे एलोपैथी है, वो देखती है कि आप एविडेंस को
एविडेंस
क्या
क्या
बोलते
है.
हैं. हाँ हाँ.
Hindi is really, I'm very poor in Hindi also.
I think I will go ahead with in English only.
Yes, yes.
Then Ayurveda is like the Gram Panchayat, passing judgment and trying to deliver justice by relying on age-old traditional wisdom handed over by previous generations. Homeopathy is much like a close family friend come well-wisher, passing judgments and trying to deliver justice by relying upon highly personalized knowledge of a person not accessible to any outside member. Aim of all the three is to give justice. In our case, to improve health. But the approach is different.
Correct. Approach is different. बट सर आप अभी प्रैक्टिस कर रहे हैं तो आपको सिमिलैरिटीज क्या दिखती है ये तीन पैथी में, एलोपैथी, आयुर्वेदा एंड होम्योपैथी?
See, the first similarity is that the medicines in all the three pathies are sourced from plants, minerals, and animals. Details I have mentioned in the book. Second similarity is same medicine may be used for the same purpose in all the three pathies. I have given some examples in the book. Because of lack of time, I cannot elaborate further.
Yes.
And side effects may be produced by consumption of medicines of all the three pathies. ऐसा थोड़ा सा एलोपैथी के बारे में लोगों को लगता है कि सिर्फ एलोपैथी में ही साइड इफेक्ट्स होते हैं. ऐसा नहीं है. आयुर्वेदा और होम्योपैथी में भी साइड इफेक्ट्स होते हैं, लेकिन वो जो टेक्निकल डिटेल्स है कि तो वो मैंने किताब में दिए हैं, तो वो जरा समझने के लिए डिफिकल्ट जाएगा.
Yes, if you give homeopathy also does have side effects. लोगों को ऐसा लगता है कि it's a pseudo science and क्या क्या बात करते हैं. But I know that you will absolutely disagree to this कि homeopathy is a pseudo science. Is it a pseudo science?
It is a pure science and it is a fantastic science. Homeopathy is, I think, medicine of the future, truly speaking. It has
only
that
thing
potential.
Is like what you said, homeopathy practice is not that easy. You really need, it's very difficult to practice homeopathy. But yes, when magic happens, the homeopath is always very happy when that result you get in 1 minute or within 3 minutes. So that is there, of course. Sir, and what about the rapidity of action? Like when we give medicines, आयुर्वेदा हो, होम्योपैथी हो, एलोपैथी हो, तो ये जो टेक्निक्स अलग अलग है ऑफ गिविंग मेडिसिन एंड उसका रिस्पॉन्स जब हम एनालाइज करते हैं, तो हाउ दिस इज डिफरेंट इन ऑल थ्री पैथीज?
Dr. Gayatri, the viewers will be surprised to know that in my experience, the fastest results I have found not with allopathy, but with homeopathy.
Oh, great.
No, really. I mean, when a well-selected bull's eye remedy is given in a correct potency to a patient with recent onset symptoms, the response seen is within seconds. The fastest I have seen is 1 to 2 seconds. The symptoms literally, they just disappear like magic. That is.
But I will interrupt here कि मैं viewers को ये भी बता दूं, because I am a homeopath, I have that right to say this, कि ये जो रिजल्ट सर बात कर रहे हैं ये हर टाइम केस में नहीं पॉसिबल होते हैं. हाँ, because it happens, it requires that correct time कि जब पेशेंट आपके पास आए, correct, yes, because correct time is very important when patient comes to you, and correct doctor is also important. So मैं हर एपिसोड में ये बोलती हूँ कि हमारे सर हरदम बोलते थे कि डोंट criticize the pathy, you criticize the doctor. Pathy is always correct and good, but doctor might make mistakes, but pathy will never make mistake. So it is
See,
something like that.
allopathy no doubt gives very fast, very consistent results and in a predictable fashion. Ayurveda
Yes.
usually takes a long time to act, but I have noticed extremely fast results in the treatment of migraine when you use Ayurvedic parasurgical techniques like Rakta Moksha. Another example
Acha.
is very rapid reduction in the pain of calcaneal spur when Agni
Huh.
Karma is done using Mrittika Shalaka. Shall I give you one?
So what is this? Yes, yes, because even
Just
I'm not understanding. Huh? Yes, you
yes, I
tell.
will just narrate one example. Rakta Mokshan is basically blood removal.
Acha.
I was I was part of a team of doctors giving service in a health checkup camp. Okay,
Acha.
health camp. I was part. We were giving our service there. So one patient came. That woman was complaining of extreme headache. She had been traveling for the past 2 days, and she told me, "Doctor, I have taken 6 different types of allopathic medicines, and still my headache is not going." And it was
Oh.
obvious from the expressions on her face that she was in great distress. So,
Hmm.
on the spur of the moment, I thought of Rakta Mokshan. So, first I asked her few questions to confirm the diagnosis, to rule out the contraindications for Rakta Mokshan, and I started the procedure. And you will not believe, Dr. Gayatri, that within say 2 minutes, her headache started getting relieved, and even before my procedure was over, there was a substantial reduction in her headache. And the next day, when she came for follow up, na, she said, "No, doctor, it has gone." So that fast
So
it
this
can
is
happen.
Ayurvedic. This is
Ayurvedic.
Ayurvedic
Yes,
therapy
yes,
you're saying.
yes.
Oh,
It is an Ayurvedic procedure. And the Mrittika
I didn't
Shalaka is
knew
basically, yes. There is one Agni Karma, Vidya Karma. These are Ayurvedic parasurgical techniques, which I
that.
learned last year. Uh, now they are famous, but say 10 years back, people were not, even Ayurvedic doctors were not aware of it. Say about 10 years back. It was there in
Okay.
the syllabus, but it was never highlighted. So
Acha.
those parasurgical techniques in certain conditions can give very fast results.
Fast results. Hello.
Yes.
Ah, yes. Yes. So, sir, I think we have already covered this predictability point here while we were talking, ki how we can predict responses from all these pathies. So, I think I will ask you, can you just throw some insight on integration of these three pathies now that you are yourself practicing? So, what you will suggest other doctors or physicians, to how to integrate all these things into their clinical practice?
First, let me clear a misconception. Okay. Integration is not random usage of medicines of the three pathies in every patient just to show that integration is being done. That is not what is integration. This combination needs to be done only when required and
Hmm.
should be a judicious combination,
Hmm.
such that limitations of medicines of one pathy in a patient in a specific clinical situation can be offset by using medicines of the other pathy which are effective. That is what is
Right.
integration. Okay.
Integration.
Now
Hmm.
the most important reason why nowadays doctors should have a basic knowledge of all the three pathies is because patients themselves are taking treatment from more than one pathy.
True.
Okay.
Very true.
If the treating doctor does not have at least a basic knowledge of the three pathies, serious blunders can happen in diagnosis as well as treatment. I have
Hmm.
given few examples in my book. I will now, because you are a homeopath, I will just share one of them.
Hmm. Hmm.
Suppose a patient goes to the homeopathic doctor, and the homeopath decides to give a constitutional treatment to the patient and
Right.
gives silicea. Let us say, for example, silicea. The
Silisha.
patient
Okay.
takes, okay, silicea. So the patient takes one dose of silicea, and after some time, the patient starts experiencing headache. He was experiencing headache in the past, but he has forgotten to give that history to the homeopath doctor. Okay. Ideally, what should the patient do? The patient should phone the homeopath doctor, right? But what
this has
patients
happened.
Yes. What patients normally do, they assume that this is a side effect of the homeopathy, and then they will go either to the allopathic doctor or the Ayurvedic doctor. Naturally, they will try to relieve the symptoms of the patients, isn't it? By giving allopathic or
I
Ayurvedic
got an
medicine.
idea. I got an idea where you are going. Yes.
So, as you know, return of old symptoms or
Correct.
resurfacing of suppressed diseases.
Resurfacing of symptoms, suppressed
Yes, of
disease. Correct.
suppressed diseases is one of the clinical response patterns even to a correctly selected homeopathic remedy, right? And as
Right.
homeopath, what we will advise, we will tell the patient, no, please bear it for a few days. In my experience, 3 to 4 days. Literature mentions up to 7 days, but usually up to 3 to 4 days. And then that
Yes.
symptom, it goes forever. So as homeopath, we will
Correct.
tell the patient, this is not to be treated. Understood?
Correct.
At the most,
So
what
many
we
of
will
the
do.
times I have also done this. Yes, I have also asked patient, and already I tell patient, ki, see, this is what you can expect. Sometimes
Yes.
what we say, good aggravation. So sometimes
Yes.
aggravation is there, which is expected and which is good. तो
And
लोगों
it
को
is
ऐसा
welcome.
लगता है कि ये मेरा बढ़ गया, हाँ, but we want that to happen, कि वो
Yes.
बढ़ के फिर जो रिग्रेस होता है वो परमानेंट जाता है. तो
Permanent
ये
जाता
सब चीजें, हाँ, so ये एक्सप्लेन करना पड़ता है कभी कभी पेशेंट्स को, आई फील, बिकॉज दे
Yes.
डोंट अंडरस्टैंड हाउ होम्योपैथी वर्क्स.
Yes.
So
Another
yes, that is
important point I
important.
want to make is big hospitals at least should have one. This is a new concept I'm putting in front of the viewers. Okay. Many doctors also will ultimately listen to our conversation.
Yes,
So big hospitals at least should have one integrated medicine practitioner on their staff whose primary
correct.
role will be to help solve day-to-day problems which arise when patients they use polypathy. Okay.
हाँ,
Third
true.
point is there is need for research into integrated medicine. See, this field is in its infancy. When
True.
I
Very,
wrote
it's just recent stage. Yes.
very nascent stage, and when I wrote the book, I didn't have anything to refer to really, so I had to rely on my own experience, isn't it? When I wrote the book,
Correct.
and shall I tell you some avenues for integration?
Yes, yes, sure.
Yes, so that can conclude our session. So first is use of homeopathy just before surgery in order to allay the anxiety of the patient, reduce
Okay.
intraoperative as well as post-operative bleeding, and to speed up the healing of wound. One avenue.
Right.
Second avenue is childbirth.
हाँ.
Okay.
Yes.
Ayurvedic Garbha Sanskar can be given even while the baby is inside the mother's womb. Homeopathy can be used either to prevent abortion or to change the lie of the baby.
Full eye of the baby. Yes.
Yes, or
That
to
is commonly
safeguard.
used. Everybody knows what
Yes,
is used, which
yes,
medicine is used in homeopathy.
and safeguard
All
safeguard.
gynacs use this. All gynacs have 2, 3 medicines, which I can right now tell that every gynac must have used these in his or her practice. 3
Homeopathic
homeopathic
medicines.
medicines.
Homeopathic
Yes.
medicines. Oh,
Pulsatilla is used. Pulsatilla is used for the lie. So there are
okay.
many which have been used.
Yes, so this is the second avenue. Third avenue is use of allopathic medicines at the beginning of a health crisis and in the emergency situation. And once the patient is stabilized, then you can go over to homeopathy or Ayurveda, depending upon the case. Fourth avenue is, this is important, in conditions where there are highly effective allopathic medicines, for example, cetirizine to treat the itching, pruritus, associated with chronic urticaria, the integrated medicine practitioner can start off with cetirizine and skillfully shift to homeopathy and Ayurveda to prevent dependency. Dr.
Okay.
Gayatri, this is very important point I
This
am
is
making.
important. Hmm.
Because drug dependency I have noted only with the usage of allopathic medicines, and it is a horrible condition it is very difficult to treat with even homeopathy and Ayurveda, and really one has to prevent drug dependency. Okay.
सर आई थिंक ये व्यूअर्स को हमने हिंदी में बोलना चाहिए. वेरी इंपॉर्टेंट पॉइंट दैट यू हैव सेड. यस, प्लीज रिपीट दैट लास्ट पॉइंट दैट यू हैव
Yes, मैं
सेड.
कोशिश करूंगा हिंदी में ये बताने की. क्या होता है जब एलोपैथी कुछ मेडिसिन व्यूअर्स पेशेंट्स लेते हैं ना, तो उस मेडिसिन के ऊपर डिपेंडेंस हो जाता है.
डिपेंडेंसी होती है.
फॉर एग्जाम्पल, जब कोई अल्कोहलिक रहता है, शराबी जो रहता है, वो कैसे शराब के ऊपर डिपेंडेंट रहता है ना. वैसे ही कुछ मेडिसिन के बारे में ऐसा होता है, एलोपैथिक मेडिसिन के बारे में, कि पेशेंट डिपेंडेंट होता है. और ये डिपेंडेंसी इतनी बुरी रहती है कि अगर पेशेंट चाहे भी तो उससे वो छुटकारा उसको नहीं मिलता है वो छुटकारा. और होम्योपैथी और आयुर्वेदिक ट्रीटमेंट भी अगर आपने कोशिश की तो इजी नहीं है. यानी आई एम नॉट सेइंग कि सक्सेस बिल्कुल नहीं मिलता है, लेकिन बहुत डिफिकल्ट है. सो हमें क्या करना चाहिए कि एक्चुअली इट इज अ ड्यूटी ऑफ द allopathic doctor who is prescribing the medicine to ensure that dependency does not occur. It is possible to do that. Then the fifth avenue for integration is psoriasis. आपको तो पता है कि psoriasis एक बहुत difficult चमड़ी की बीमारी है.
Yes.
Chronic. It is difficult to treat by all the three pathies. और क्या होता है, one common clinical experience is suppose a allopathic doctor or homeopathic or ayurvedic doctor gives a good medicine, तो इनिशियली पेशेंट रिस्पॉन्ड करता है, लेकिन बाद में पेशेंट स्टॉप्स रिस्पॉन्डिंग. तो ऐसे वक्त क्या करना चाहिए? यू शुड यूज ऑल्टरनेटिव. लेकिन अगर आप सिर्फ एलोपैथी, सिर्फ होम्योपैथी या फिर सिर्फ आयुर्वेदिक करते हो, तो आपके पास थेरेप्यूटिक ऑप्शंस कम रहते हैं इन ट्रीटमेंट ऑफ सोरियासिस. लेकिन अगर आपको तीनों पता है तो आप इसके बाद ये, इसके बाद वो आप इस्तेमाल कर सकते हैं, स्पेशली सोरियासिस. So
I think, sir, but what you are saying, all these points are possible for a physician only when he has knowledge about all three systems, at least some basic knowledge. Otherwise, it becomes very difficult to gauge कि कौन से केस में हमने एलोपैथी कम होम्योपैथी, because बहुत पेशेंट्स आते हैं और कॉमन क्वेश्चन रहता है पेशेंट का. मुझे भी मोस्ट ऑफ द टाइम्स पेशेंट बोलते हैं कि मैं एलोपैथी मेडिसिन ले रहा हूँ, तो आपका होम्योपैथी भी चलेगा क्या उसके साथ? So this is very common question asked by patients. So I know what I usually answer, but sir, आपका, you being an allopath, what is your clinical experience to this question which is asked?
See, actually you can use both homeopathy as well as Ayurvedic medicines with allopathic medicines. Of course, as an integrated medicine practitioner, first I think when I treat the patient, I will first decide whether it is really required. Okay. And then what I tell the patient is keep some gap between the medicines, especially Ayurvedic and allopathic. Homeopathy, as you know, कि कभी कभी कैसा होता है, I give a single dose, single weight dose, बस stop and just give Saclac. Okay. So there it's a judicious comment, and these are very technical things.
Right.
ये ऐसे easily नहीं बता सकते.
ये पेशेंट समझ भी नहीं पाएगा. That is our domain.
Very complex है, ये complex है बहुत.
It's very complex. It's all very complex. That is true. लेकिन व्यूअर्स को हम एक चीज जरूर आई थिंक बताएंगे कि आज के सेशन से आपको पैथोलॉजी के बारे में भी थोड़ी बहुत जानकारी मिली, एंड एज वेल एज एलोपैथी, होम्योपैथी और आयुर्वेदिक सिस्टम कैसे मिलके भी डॉक्टर्स प्रैक्टिस करते हैं, जो नाउअडेज वी कॉल इट एज इंटीग्रेटिव मेडिसिनल थेरेपी. तो जरूर you can always go ahead for such treatment plans which will always help you. So I think anything else you want to speak about, sir? I think my questions I'm done with my questions. Anything from your side you want to tell? How you feel, how this session is, Doctor series?
Dr. Gayatri, I have listened to other videos of yours also, and I really feel you are doing a fantastic job, Dr. Gayatri, and you must be congratulated for that. Not only you, your entire team. especially this Universal Health Organization and
Yes,
Awaken
yes,
India
yes.
movement.
UH and Awaken India movement.
And basically, whatever you are doing is you are doing selfless job, and it's a fantastic work that you are doing. Keep up the good work. My
Thank you,
best
sir.
wishes to
Yes.
you.
Yes, thanks. And we expect more doctors like you know, to come on such platforms and share views, because जितने हम doctors से, you know, contacts में आएंगे, तो हर एक, now see, when I called you, you are speaking all these things, and लोगों को मालूम पड़ रहा है कि एलोपैथी डॉक्टर का भी ऐसा व्यू होता है. तो जब तक हम लोग आगे आके अपनी बात नहीं रखते, तब तक लोगों को मालूम ही नहीं पड़ता है. Even doctors are not aware. Even I was not aware that a pathologist can do such work, fantastic work into, you know, medical field. So that was why I invited you, and I'm really thankful that you gave your time, precious time out of your practice schedules, और आप आज session में आए. And I'm sure I'm going to call you again, because this pathology topic is vast topic. और मेरा जो बहुत important सवाल है, 3 सालों से मैं बहुत अपेक्षा कर रही हूँ कि इसके ऊपर चर्चा हो. तो maybe next month sometime we will surely do
I'll
this.
come again.
Yes, we will call maybe more couple of doctors who will, you know, co-panel, so that we
Sure.
can have a good doctors dialogue on that. और मैं व्यूअर्स को बता दूं कि ये सेशंस मैं QY टीम के साथ, अवेकन इंडिया मूवमेंट टीम के साथ एंड यूनिवर्सल हेल्थ ऑर्गेनाइजेशन के साथ करती हूँ हर फ्राइडे. एवरी फ्राइडे वंस इन अ वीक सेशन रहता है. अलग अलग डॉक्टर्स से हम चर्चा करते हैं अलग अलग स्वास्थ्य के टॉपिक पे. एंड दिस प्लेटफॉर्म एक्चुअली इज ओपन फॉर ऑल. तो आपने, अगर किसी व्यूअर ने मेरे पूरे लास्ट सेशंस देखे होंगे, so I think I have covered almost all doctors from different fields, allopathy doctors, homeopathy doctor, naturopathist, you know, allopathy, every field. So I'm expecting many more doctors to join this movement. Actually, I consider this doctors dialogue as a doctors movement. So I request, you know, कि doctors जो भी अगर सुन रहे हैं, तो आप please आगे आइए and contribute to these series and sessions and keep your views in front of public. So I think thanks Dr. Amol for joining us today. And सभी viewers को मैं बोलती हूँ कि next Friday again we will be having a different doctor with a very new topic again for discussion. So thanks all. Thank you, sir.
Yes. Thank you, Dr.